My name is Nelly, and this presentation is about an infectious disease called gas gangrene. Another name for this infection is myonecrosis, meaning death of the muscle. It progresses in a fast pace, and in most cases, it attacks the soft tissue. It is very dangerous because in a short period of time, it can necrotize a whole limb, like a person's hands or feet. This infection is caused by Clostridium perfringens, which are gram-positive, obligate anaerobes. They require low oxygen levels to be able to multiply. These bacteria are spore-forming bacillus from the genus Clostridium. There are about 3,000 cases per year reported in the United States. Gas gangrene can be classified into two categories, post-traumatic and post-operative. 60% of the cases are from an infected trauma, and the remaining 40% are caused by a surgical complication. The mortality rate can differ depending if treatment was applied immediately. It is fatal if infection has progressed into higher stages. The skin will show signs of infection within the first 6 to 8 hours. The muscle tissue will start to deteriorate, affecting several inches of the skin every hour, as shown on these images. In severe cases, the body will go into shock and possible organ failure. That will happen in 50% of severe cases, and among that number, 40% die. Amputation remains the safest life-saving treatment. Gas gangrene can appear anywhere on the body. It takes just 48 hours to cause death. Some of the most common symptoms are fever and increased heart rate. This infection traps air inside the muscle tissue. The skin will become pale at first and then change into dark red or even purple. When pressure is applied to the wound, it makes crackling sounds due to the gas. Warning for graphic images. Spontaneous gas gangrene has the worst prognosis. It has to be diagnosed early in order to treat it. These images show severe cases. When in surgery, complications can begin to arise from a simple mistake, which can later cause a major infection. The most important part is to diagnose the infection before it becomes severe. In order to do that, the physician will do a physical examination of the possible infection. Then the skin culture will be tested for the presence of Clostridium perfringens. After that, a blood test will be performed to show the white blood cell count. If it is increased, that means there is an infection. The 5 treatments that are most commonly used in the United States are antibiotics, surgery, hyperbaric oxygen therapy, advanced tissue repair, and amputation. First, antibiotics are used to minimize bacteria. In specific, penicillin and clindamycin get inserted through the vein. Next, surgery is necessary in almost all cases. It is performed to remove the dead tissue and to increase oxygen saturation in the wound. After that, hyperbaric oxygen therapy is a new advanced approach used to slow down the necrosis of the tissue. Continuing, the advanced tissue repair method uses umbilical skin that has been kept in frozen temperatures. It gets sewn on top of the treated infection so it can heal properly. The last, most brutal, but safest method is to amputate the infected part of the body. In conclusion, back in the day, this infection was found more often in the battlefields rather than on a surgical table. Although cases have decreased since then, experimental approaches are still being created. The most important factor to destroying the bacteria is to identify it, diagnose it, and do it as fast as possible. This is my reference page. Thank you so much.